Hello viewers, welcome to my channel, The Silent Crisis Unmasking Insomnia. This is today's topic. Insomnia. That means it is a problem when we are not able to fall asleep at night. Even the light is off, even everybody is sleeping beside us, but still we cannot sleep. That particular problem is called insomnia. We can see that 60 million reasons to wake up. We have many reasons to wake up. And if we go for the statistics, 60 million Indians are affected in insomnia annually. That means it's a very important issue nowadays. One adult out of 10 adults suffering from chronic insomnia, living with persistent long-term sleep disruption. That means they cannot sleep. 75% of the people experience symptoms weekly, report sleep disorder symptoms at least once a week. So this is the statistics of insomnia in India. Now we have to know what is insomnia. You can see here open eye even in the night. Insomnia is a persistent difficulty falling or staying asleep, despite not only the problem of falling asleep but also staying asleep, despite having adequate opportunity to do so. It is not simply a matter of tiredness or a rough night. That means due to any reason, a person is not able to fall asleep at night, or if even he falls asleep or she falls asleep, cannot stay in that sleepy condition for the whole night. That is insomnia. Now, what is chronic insomnia? 3+ nights per week or 3 months, 3+ months. For 3+ months means if a person is not able to sleep for long 3 months and in each week 3 nights, that means for if we think that there are 4 weeks in a month, then means 3 into 4, 12 non-sleepy nights in 1 month. Then like that, if 3 months it is continued, it is called chronic insomnia. Physiological hyperarousal, a state of heightened biological alertness, not just sleep deprivation. That means the whole body is biologically alert. The state of hyperarousal. In insomnia, the brain never truly powers down. Elevated neural activity, particularly in regions governing threat detection and emotional processing, keeps the body in a persistent state of alertness, even when the lights goes out. Means when a person is in the state of the hyperarousal and then the person is suffering from insomnia, even the light is put off, then what is the reason? Elevated neural activity. That means the nervous system is not cooled down, particularly in which region? Governing the threat detection. That means the person feels threatened. And emotional processing, or the person is emotionally disturbed. So these two are the main reason for the hyperarousal of the brain, which actually causes the insomnia. What is the biology? Number one, sympathetic overdrive. What is sympathetic overdrive? Metabolic rate and the heart rate remains elevated when they should be falling. Means at night our metabolic rate slows down, our heart rate slows down, because after a total days of high work, the heart rate, the metabolic rate slows down. Stomach needs some rest and the heart also needs some rest. So this is, but in case of this hyper arousal problem, there is elevated heart rate. Means heart rate is increased and metabolism also increased at night. Means the stomach and the heart is not going to get some rest. Then comes the hormonal dysregulation. Cortisol and ACTH remains high. See, cortisol and ACTH fail to drop at night, blocking the natural wind down process. This cortisol and adrenocorticotropic hormone ACTH, these two remains higher in the daytime, and during the night time they gradually slows down so that the total body can get some rest. But in case of this insomnia patient, this two hormone is doesn't drop at night. They remains in their normal condition or high. Circadian rhythms drift. Light conflicts with the body clock. What is circadian rhythm? Circadian rhythm means it's a rhythm of our body which controls the rest and the working cycle of our body. Like in the daytime, we actually, most of us actually work, and during the night time we sleep. It is the circadian rhythm of those people who actually work in the daylight. But in case of the shift workers in the night, like the night watchman, nurse, doctors, etc., who give their services at night, their circadian rhythm is just opposite to us. Like they sleep in the morning and they remain alert in the night. So when a person is working in the daytime but still suffering from the insomnia, that means the circadian rhythm is totally upside down. The phases of risk. What are the risk factors? Age and gender. Risk increases with age. Women are significantly more likely to experience insomnia across their lifespan. I can recall one article in the journal, American journal, which says actually that the woman feel much more insecurity, and so the brain is always alert, and they almost feel threatened even in the house also, and they with the constant work of the whole day, their nervous systems are still hyper arousal even at the night. So this is the reason why women are significantly more likely to experience insomnia. But as the age increases, this problem can appear in both the gender, both male and female. Psychiatric comorbidity. Depression and anxiety are both a cause and consequence of chronic sleep deprivation. If a person is depressed, means do not want to do its daily work. Anxious means both the mental and the physical exhaustions are there. Means if there is psychological problem, then this insomnia can arise. Medical condition, chronic pain, heart disease, then lung conditions directly interfere with the sleep architecture. So in these three conditions, a people cannot sleep at night properly. Chronic pain, if a person feels pain in the stomach due to arthritis, due to headache for the whole night, then he or she cannot sleep properly. Then if a person suffers from heart disease, then there is elevated heart rate at night. It hinders the sleeping pattern. There is lung condition is not good, that means suffering from asthma or any other type of lung problems, then the respiratory system becomes weak and may give some trouble during the peaceful sleep at night. So these three are the phases of the risk. Number one, the age, the gender, the psychiatric comorbidity, and the medical conditions. What are the hidden costs? Drowsy driving, a 20-second microsleep at the wheel is functionally equivalent to a blood alcohol level of 0.08. That means if you are suffering from insomnia, you can have 20 seconds of microsleep, which can do any trouble. It can cause an accident and all, and it can be compared with the 0.08 level of blood alcohol. So both are similar, both are not good. Inflammation, chronic sleep loss elevates inflammatory markers, raising the long-term risk for obesity and the diabetes. So if a person doesn't sleep for a long period of time, there is high chance that the person will suffer from obesity and diabetes. And as we all know, that both these two, obesity and the diabetes, they directly affect on the kidney and the mental status of a person. The comorbidity trap. What is the core problem? Over 80% of insomnia cases are secondary to other health issues, yet insomnia is often treated in isolation or ignored entirely. Actually, we can understand that a person is suffering from less amount of sleep at night. We say that okay, this is maybe due to your mental status, this is maybe due to your health issues, but we don't actually give that much priority to that person that let's go to the doctor, show the doctor what is your problem, discuss with a counselor, like that. So it's a core problem, it might be treated well, but we actually ignore it. Why it matters? Treating the underlying condition, depression, pain, anxiety, often resolve the sleep disorder. Failing to address both leads to a compounding cycle of health decline. Integrated care addressing both primary and secondary condition yields the best outcome. That means we have to find the root cause. The person may not sleep at night properly, maybe due to the depressive mind, maybe due to some pain, maybe due to anxiety, or maybe due to any cause. So we have to treat it well. We have to means highlight the problem. We have to go to the root cause and we have to solve the problem. Breaking the cycle, evidence-based care. So first one is CBT1. What is CBT? Cognitive behavioral therapy for insomnia, that is called CBT1. It is a gold standard non-pharmacological therapy, and it is recognized as the at the first line of treatment, more effective than long-term medication, and it has got no side effects. So this is the first treatment we can give to an insomnia patient. Then behavioral techniques are also there, stimulus control and the sleep restriction, then lifestyle hygiene, light, then meals, and then circadian timing. So these three can help a person to get rid from the insomnia. Reclaim your rest. Insomnia is treatable, not inevitable. That means we can get rid of this problem. The fast sleep is simply acknowledging the problem. Stop ignoring the sign. Chronic fatigue, irritability, and the brain fog are the signals which are not normal. That means if a person is telling that he or she is suffering from the fatigue, that means not feeling well, there are pain in the leg and the arm or in the back of the neck, then we should not ignore it. He or she may be irritable, or there will be brain fog. What is brain fog? A person cannot think properly, clearly, cannot tell something properly. So we should not uh, ignore all these signs, because these signs are not normal. Number two, talk to your physician. Sleep is a vital sign. Include it in every health conversation. Means when you will discuss about your health issues with your physician, then if you are suffering from the less amount of sleep, then talk it with your physician. Start today. Sleep is the foundation of the health. Restoring it restores everything else. If we doesn't sleep well, then less amount of energy you will get for the next day's work. So we should reclaim our rest. We should not ignore the foundation of our health, that is the sleep. So today I have discussed with a very important issues of nowadays, that is insomnia. Most of us suffer from this disease, we know well. So if you like this video, please share and do subscribe and be with me, because this is my new channel, and every day, almost every day, I am going to bring new trending health issues to increase the awareness about health among the population. So thank you for watching. Again, wait for the next trending health issues tomorrow or day after tomorrow. Thank you for being with me.